Here we are, Renee. What is it we're talking about today?
Well, we have a really fun conversation today. We actually have been asked and done this numerous times now to chat with Lead Des Moines, and they always ask us to talk about systems. And that's one of the things we live and breathe every day. But it's always fun to bring it to a different group of people that are looking to be leaders in their community who want to make change in their systems. It's going to be a fun conversation because we always have to remind people the personal side of that, right? You always want to jump to transformational change, you'll tell me,
Yep.
and they forget the basics. And so we're going to talk through the basics of what is change actually, how to do kind of some change management and how does that work. So before we really dive into that though, Jason, what is going on the farm here at the beginning of November? Are you done with harvest yet or what?
No, there's still hauling and trucks. If you notice, I'm in a hotel today, so I'm not even farming, which is where I
Uh-oh.
should be right now. But
Uh-oh.
I saw alerts on my phone that grain's getting hauled because we're still clearing space out and getting stuff done. Renee, we blew a tire on the grain truck the other day, and I don't
Ooh.
know if you know this, but when you blow a tire up on an inside dual, it does a lot of damage to, you see the
Oh,
shreds of tires on the interstate. Well, when
yeah.
you're loaded and that happens, you don't realize how much damage that stuff does to the truck. And we have a little switch on the back of our truck. It's an air switch. It's a three-way air switch, Renee. I'm sure you have these laying around your house.
Absolutely.
It's what raises the truck up to dump the grain when we get to the ethanol plant. And it broke that switch. And so we had to run around trying to find a three-way air switch. And you know what, Renee? These aren't on the shelf of most stores. Um,
I can't imagine why
because
not.
not a lot of people have three-way auxiliary
Not a lot of
switches.
people are driving grain trucks with
No,
interior
no. A
tires.
lot of people have
So,
semis now. They have grain trucks with hydraulic lift beds run by
oh,
air switches. And let me give a shout out to Randy and Carol. Randy's diesel repair shop. One of his mechanics found one in his junk drawer of his
nice.
toolbox and
That
just gave it to us. That's
Yes. So this reminds me of our conversation back with Kayla, and you called it all gold that you have in the farm of all
yep,
your old stuff. And right there is a
right
reason not to
there's
get rid of something
why you
because you
keep
might need it.
everything because someday your neighbor might need it. So
Oh,
you keep
man.
everything
Look at
no
that,
matter
Randy and
what.
Carol. You guys go. Well, today we're going to talk about systems. And whenever we go out and talk about systems in public, we always kind of do a level set and kind of remind people where we are in the world today and kind of give people some information. And we've been doing this a long time, and it's fascinating to me how many people still don't know it, even though you and I have said it 1,000 times. But when we talk about that level set, Jason, what are some of the data points that we always like to hit on to tell everybody? Like we always say, like, okay, what's been going on in the last 5 years?
Yeah.
And get everybody kind of thinking about that collectively. But then there's like a whole lot of just information we give people about this is where the world is. Why do you say that's important? Why is that a good place to start in a conversation about systems?
We've all been impacted by disasters. The pandemic, we're still talking about that. I happen to be up in an area, Northwest Iowa, that's impacted by a flood. And it was impacted right after the pandemic. There was a huge flood up here. Every day, people are still talking about that. We were in meetings all day, and people are still talking about the impacts and the housing impacts from that event. And you can still see, just like, Renee, going back to Cedar Rapids, when you were there in Cedar Rapids, that flood still impacts people today. And so we have to recognize where communities find themselves when we think about disasters and just
Mhm.
the stressors of the world around us today has impacted everyone differently. But we need to recognize that.
Yeah, and I think about where you are now today. You guys happen to be up in Spencer working, and they had a big flood. And
Yeah.
so, and they're really closer to it, right, than Cedar Rapids.
Yep.
And I'm sure it's still impacting them and heard stories
Absolutely.
about like some of their downtown is still empty and not back up. And
Mhm.
so when you do this level set, it impacts people differently depending upon where they are. And then there's worldwide things that impact people, but then there's more local issues. And so we always talk about things like derechos and disasters and floods and those kind of things. But then you also think about like right now it's tariffs and trade
Right.
wars and just different issues that are impacting maybe commodity prices or,
Yep.
cost of food, the costs of inflation. I mean, there's just so many issues and that basically collectively stresses people out because as you and I both have talked about, we have more access to what's going on around the world today than we ever have. So as a disaster across the world that you never have heard about in the past, now you can have instant access to it and it just compounds the stress on top of people and they're just hearing and seeing more things that are challenging worldwide. And so it's a lot to take in for people.
Absolutely. And
So
what do we
what some of
know?
the Why don't you talk about some of the data? You always talk about, like, besides the partying, drinking data. You just were telling me
Oh,
that partying is actually not going the direction I thought it was. What's going on with partying in the world today?
well, I mean, there's been a lot of data coming out recently that we're drinking less as
Interesting.
Americans. And, we do a lot of talking about drinking and we talk a lot about isolation, right? And what we're seeing is the death of partying. And if you're 15 to 24 years old, there was some data run about attending or hosting a social event from 2003 to 2024. And that segment of 15 to 24-year-olds decreased 69%.
Wow.
Kids aren't going out, right? And so I think about my kids, I think about that younger population. They don't know how to be social. And we've overlaid this. We've talked about the death of bowling alleys across rural communities.
Yeah.
But I see it with local service clubs as well, is that those were oftentimes social organizations going to lunch at noon every Friday as a Kiwanian. Renee was making fun of me earlier because I'm a Kiwanian serving on the board of directors. But what we know is younger generations aren't being social. And maybe sometimes, unfortunately, we learned how to drink in high school, likely at a social event, and those social events don't occur anymore. And so that is having an impact on society, Renee.
Yeah, actually it is. And, people that don't know how to express themselves are sitting behind computers and yelling at people into the void and disconnected. And so that isolation data, we've talked about this before, but the isolation data from the Surgeon General a couple years ago showing that it's more, dangerous to be isolated than to be smoking a whole pack of cigarettes a day. And
Right.
that's just mind blowing. And so you're right. The more less social we are, the less we're going out. Now, I don't know that not drinking as much is a bad thing because we drink too much and it causes all kinds of
Yep.
cancers. And we have not talked about it. We've sort of buried that in the data. But, the fact that that was always around a social event, though, makes it, again, more
Right.
isolative. So
Now,
that's a problem.
we may be using more pot, though. So there's
Oh,
other things
well,
to
all
take
right.
into account that we're not taking into account right now.
Yep. And another topic we always hit on is burnout. So why do we talk about burnout when we're talking to leaders? Why is that an important conversation?
Well, because that's impacting our workforce. And I don't
Okay.
think that we're always acknowledging that in the workplace, the extent that burnout, and we see that in healthcare, especially, but just the environment we find ourselves in the workplace today, it's really a charged environment. And so, I think we just have to acknowledge that burnout is real, anxiety and stress in the workplace is real. And what are we doing about that? How are we addressing it in the workplace? And a lot of folks are trying to ignore it still, Renee.
Yeah, and we talked about this when we talked about rural in Missouri at your conference
Mhm.
about the numbers of people retiring in the rural
Oh,
communities for
huge.
physicians. So if you add the burnout on top of the amount of just retirements from the aging population of doctors, I mean, we're going to be in a world of hurt because there's a lot of people that aren't healthy enough to do the job, even if they stayed in the community to do the job. And so it's really a big deal. So the other piece we're talking about and bringing to light this year is how much this costs. What are those impacts financially? It's got to be massive.
Well, what we're looking at, there's some projected costs of economic impact of mental health inequalities in the United States. And when we look at overutilization in EDs, the absenteeism or presenteeism in the
Hmm.
workplace, it's costing us billions and billions of dollars. And I think that at a time where we're reducing healthcare coverage for a lot of individuals, I don't think we're always accounting for really the projected impact this is going to have on our economy and the cost to society, that's almost uncalculatable is that a real word? But
I'll go with it.
okay, as we look to the future. And so we really need to think about what can we do, what can we do to impact our systems moving forward to create a healthier society?
Yep. And so we always kind of, end all that segment of our talks when we talk about the reality of the situation. And the reality of the situation is the systems we do have are disconnected, right? They're just
Yep.
not a likely warm handoff. If you're a person in need of a service, you may get put to the wrong place. You may get put to the wrong level of care. You may get stuck in a queue that you can't even get to the help that you're looking for if you get there at all. And so we always kind of level set everybody personally, but then also look at that system reality that the systems aren't working the way they're supposed to. And with Lead Des Moines and other groups like them, they're like, okay, how can we change the systems? So then when we start a conversation about that, Jason, we always talk about having candid conversations. It's sort of where we always start. And you guys have
Yep.
taken that to a whole new level this past couple of years with some of the projects you've been working on. But when you think of candid conversations, Jason, it always leads to these things we now call convenings, which seem to be a new word that everybody's
Does.
talking about. What's a convening, Jason, and how have you guys used them?
Convening is when we have a leader or someone who's perceived as a leader, bring a group of people together and start a conversation of what things need to look like differently. And we've used the leveraged a lot of political figures. We've had a lot of state legislators come to us and say, help me have this conversations with my constituents, with law enforcement, with CEOs of hospitals. And we've really specialized now in bringing people together. We're doing a statewide project here in the state of Iowa where we're leading convenings. We're doing a project in Illinois, Southern Illinois, in a rural area where we're bringing people together. We did this in Nebraska. We just returned to Nebraska to kind of hear what the next steps of a report that we authored a year and a half ago, and had legislators from the state of Nebraska come together and ask us questions about how do they move their system forward. And I think, we have to think about when we talk about convening, we have to think about the conditions of systems change. I don't know if people remember
Mhm.
this book, The Water of Systems Change. It kind of goes back a little bit, but I really love when we think about the 6 conditions of systems change. It's about policies, practices, and research flows. And that's really about structural change, right? The things that have to go into place structurally to make change happen. And then the relational change comes next. That's where relationships and connections and power dynamics help to push those policies and practices forward, moves things forward. And it's only after those things happen can we have transformative change, which is where we change the hearts and minds, right? We call that the mental models change, but that's when we get to the place where we actually change the hearts and minds of local communities. So oftentimes people want to go straight to changing hearts and minds. It doesn't work that way, Renee. We've got
No.
to build the foundation of change if we want to make change happen.
Right. And we always forget like the structural change starts with ourselves. And so
Yep.
a lot of folks, when we go to these leadership conferences, they want to change the world, they want to change the community, but they're not healthy. They haven't
Oh.
changed their own boundaries, their own, health, their diet, their exercise routines, whatever it is for them to become a healthy person. And if you can't do that for you, you certainly can't go out and change other things because that's above and beyond your daily. And you've got to think about your own personal system, but your family system, and maybe your local community or your workplace before you start thinking bigger systems.
And,
And so, and you need a lot of those healthy people together to make that change for that transformational. So you've got to build from that bottom up. And we
and
forget
how
that. We
long
forget the structure
and how
part.
long does it take, Renee? I mean, let's go back to when we think about government and when we think about policy change. How long does it take?
Oh man, so much longer than I wished it did. And what I just learned this week again, I keep learning this, but I have to like take the
Yeah.
30,000-foot view to see the change sometimes because I'm so in the middle of it and it feels so hard and upstream that I can't see anything changing. But if I take a big step back and kind of look at it from like, oh, actually, all of these
Right.
different areas are moving in the direction I was hoping they would, maybe different ways than I expected, and maybe different types of outcomes than maybe I was thinking, but it is making change. So it's being heard, it's being listened to, it's being addressed, even though I don't feel like it moves at my speed that I want it to. But it takes that. And so you're kind of always going to the structural depth to making sure the
Yep.
foundation is set and then having to pull back out to catch a vision. And not everybody has that ability to do. So it's really an important skill that our team has as part of Rural Policy Partners is to do that strategy and to do that big picture look, but not forgetting the details. Because there's some strategic folks that just make the big 30,000-foot plan and
Right.
never tell you how to make the first step. And that doesn't work. It just sits in the cloud and goes nowhere. And so there's got to have the both. You've got to have the systems and the structure basics, like the practices, the policies, the boring stuff. You got to do that first before you're going to get a system to go a direction you want it to go. And you're right, we forget that stuff. So when it talks about personal, though, this is where you always dive into the social determinants of health that tie to this. And some people will be like, well, how did that relate? But it actually is a pretty important part of this whole system conversation.
Yeah, we don't spend enough time talking about prevention when we talk about behavioral health care systems. We like to talk about continuums of care, but it all starts with prevention. And social drivers of health, the social determinants of health, is how we rate how healthy a community is, right? Every
Right.
critical access hospital does a needs assessment every 3 years all across our country, and it looks at socioeconomic factors, physical environment, health behaviors, and only 20% is actually healthcare. The healthcare that's delivered by primary care, behavioral health care, it's more about, do people have access to food? Are people unhoused or do people have stable housing? And are people engaging in healthy behaviors, tobacco cessation, diets, decreasing alcohol use? And I think sometimes we forget how important those preventative factors are in really looking and driving community health. Sometimes we get stuck on serving the sickest of the sick. And we forget if we're building everyone else to be a stronger community, we build protective factors and resilience into the system. And that makes the sickest of the sick healthier because we're all healthier across the community. And sometimes we miss the forest because of the trees, Renee.
Oh, we sure do. And so it really is important. And you're talking about like several of the conversations you're now having across rural communities. And it's basic things like being unhoused or
Yeah.
uninsured. We had that conversation on our podcast a little while back about the what's coming down from the federal government and the number of people going to be uninsured. Those are big, big barriers for small communities. And we don't think about it that way. You think about, you might see the unhoused in the big cities on television, and you may think that that's a city thing or warm climate thing, but it's not. And in our Midwestern towns across our country, our small communities are now being inundated with folks that are unhoused as well. And it only takes a few in a small community to be overwhelming for them because they were a small community to begin with. And so it's some interesting, and that's that social determinants of health piece you're talking about. It's not just your personal health, but the health of the community. And you can't even count them or make sure they have their basic needs met. So this is where the basic things like, prevention with maybe vaccinations and, disease prevention management, all of that kind of stuff doesn't happen if we're not even really treating people as people. And so it's those real basic things. So then we talk about, this is how that ties into that convening idea of, you got to get people together to talk about this. So you start out with which one of these topics are we going to focus on? Because it's a lot, right? And people can make a change, but you got to do them one at a time. You can't change the whole system at once. So you got to start there. And then once you get them in the room and get them going together, then what happens? Like once you have that first initial conversation, what have you seen kind of blow and explode from having those initial convenings?
Well, I mean, the key element to those initial convenings is we just have to get candid and get down to the root cause, right? We don't mess around when we sit down with people, Renee. What we try to do is identify what are the barriers and what can we do to remove those barriers, right? And so we think about getting candid, creative, and collaborative. That's every conversation we have, every convening we have ends in those three C's being the driver of everything we do. And I think that's what's most exciting about this work is that we're able to identify those connections and figure out how we can help to push the system forward or remove barriers or create opportunities that sometimes people just need permission to reach out in a different way, or they've closed themselves off and there's no barrier, but they've created a barrier. And sometimes we just come in and say, you know what, that's not actually a barrier, or that's not actually what HIPAA means. And so you need a different lawyer opinion, right? And Renee,
Yeah.
you'll love this, but do you know how many times I heard EMTALA violations today?
Oh,
Yep.
no,
Yep.
no,
Here we are.
no.
We're back. We've been
We're
advocating for
back.
folks and advocating that you can't violate EMTALA. And I've been in 3 rooms today, and I've heard of EMTALA violations in
Oh
all of
boy.
those rooms.
Yeah, and I think about when we get to the creative solutions part of this process, we always talk about, working with what you have and what you don't have. And that's actually my favorite, if I would say favorite part about rural, is hearing their can-do attitude when they get together on working on something, and it may not look like other places. Like you and I've talked about like what crisis services looked like in Alaska being very different than what
Yep.
you saw in Arizona, but it still got it done. And then yet here you are in Iowa, we won't say where, and they're
You
just
already
not
said
doing
where.
them.
You already said where earlier, so we
Oh,
won't.
sorry. Well, you don't have to tie it to today's conversation, but there are places in Iowa that just aren't because maybe they're having issues with somebody. It's personal. They don't like
Yeah.
whoever. They don't respond fast enough, and all those barriers, which, now you're equipped to blow through because you're like,
Right.
hey, they can do this in Alaska. You guys can figure this out.
Right.
And so it's like, I'm sure that didn't help them feel better about that when it's a nice excuse to not do it.
Well, the reason it doesn't happen in all of the states we've been, Renee, is because the two parties don't sit down in the same room
All right,
and
right,
figure out a solution forward. Like,
right.
my first question is, when was the last time you all met together? Oh, and then there's always a long pause, and it's
Mhm.
always over 2 years. Like always, like I could just predict it now
Yeah.
wherever I go. And so, when we think about being collaborative, it means you got to sit down with people that you may not get along with or you may not see eye to eye, but you have to find solutions to move the system forward. It just has to happen.
Right. And we talk about that all the time because you can't just wait for that evidence-based practice to whack you in the head with all the workforce to stand it up. It just isn't going to work in our rural communities. And so being creative and then being collaborative is the key. So you talk about that. I know some of the work that we've done in the past here in Iowa, not this time around, but the last time when you made convenings, one of the more exciting pieces of that is you introducing people to other people who they should have known the entire time,
Yep.
who they should have been working together with the entire time. And then at the end of your work together, they're now contracting together. They're now
Mhm.
creating, shared informational sheets where they now have the same information that they can share
Well,
among each other.
ironically, we went through a mental health redesign, so we have to do that all over again.
Fun.
Because over the course of the last 12 months, Renee, when everything changed, people forgot
Oh boy.
um, who their
But
partners
at least
are,
you have a
or
template you could
yeah,
rebuild.
we know, and we can walk in and say, well, here's the people, and they're like, oh, we didn't know that.
Oh boy. And you could say, and you had collective agreements where you could share
Yeah,
information before, so you can have them
right,
again.
right.
Oh man, what a mess. But yeah, that's why it continues. It's cyclical. And as you know, people retire, people move on, people move
Yep,
out, and then you've got to start again. And so it is continual, even though sometimes I feel like this is very basic and very simple. It's the same bottleneck every single time. The right people
always.
haven't been in the room to make
Yep,
decisions. And then
yep,
there's no creativity after that, and there is no collaboration if that doesn't
correct,
happen. And there's no system when there's no collaboration. It's
correct.
just crazy. So today, before we go, I'm going to talk about the recovering politician self-care policy of the week. I started listening to new music. I don't know about you. I love music and music, all kinds of varieties, all kinds of styles. And I've always really liked music. And so I create specific music lists for my aqua ladies in my aqua class. And they're always appreciative of that. And lately they've been doing a lot of 70s and 60s and they're older than me and they love all that stuff. But it's just fun. I still stay current on current music a lot of times. And so that's one of the things I have found to reduce my stress. And so there's always a kind of music that kind of goes with your mood, goes with your vibe, goes with the season. And so that's just been something for me that's been really important as part of my self-care is just making sure I take time to hear some music and, kind of get refresh my brain on a few things. Jason, is there anything that you're doing now that you're getting out of the
Oh,
combining
you're
season
not going to
soon?
tell us, you're not going to tell us the genre of music that you're
No,
embracing?
no, because it's all kinds. No,
Okay.
I'm not, but thanks. So anything you're doing new or exciting while you're heading out to the just fall
Well,
rain?
I always go through every year, I go through a country phase. When I'm in the combine, I just feel
Yeah,
like I need to
see, that
listen
makes sense.
to
It's a
old. And I was
season.
just at Farm Aid 40. Like, I'm just kind of embracing
Exactly.
the country vibe. And so, that's always the fall experience for me is I kind of go back and get a
There you
little
go.
country, but I'll be back. And before by spring break, because I love Puerto Rico, it'll be back to
Oh,
Bad Bunny.
back to Bad Bunny.
So
Well, you got
bad.
to get there by the Super Bowl. I hear he's halftime this year, so you
Yeah.
got to get to Bad Bunny by Super Bowl
next
time. So you
next
can
episode we're going to
dive into
we're
Bad
gonna we're
Bunny.
gonna dive into your actual closet Swifty status, Renee.
Oh,
So
closet Swifty. Okay. Well, good try on that. Well, today, everybody, we did a little bit different, but talking about how solutions are in the system because behavioral healthcare really is healthcare. And that's what we're talking about today. And we get to go out and talk to leaders across our community. And we're excited to be able to do that and share a message of, hey, here's where we've been. This is resetting kind of where we are and how we can all make change. And whether you are somebody that feels like you're in an organization that is making change or not, you personally can make change. You can improve the system. You can also make it worse if you choose to. Wouldn't recommend it, but you can all by your lonesome. So we're talking about how do you make systems improve for behavioral health because behavioral health is healthcare. But before you go, just want to remind you to please follow us on LinkedIn and Facebook or YouTube. And if you do, we'll send you out a nice surprise. Have a great day, everybody. We'll see you soon.